Okay, well, Congressman Cole, thank you so much for joining us today. I know that you're extremely busy, so we can't say thank you enough for carving out a little time with us. And I want to lay down just a few ground rules for everybody that's on the call today. I really appreciate our members at the Chamber being part of this call. I hope you enjoy this. This is the first one of what we hope to be many of these kinds of forums. We're also doing live interviews with different individuals, so you can join in on those as they occur. We'll have one of those on Monday afternoon on Facebook Live with the U.S. Chamber of Commerce. And then on Tuesday, and so on Monday, we're going to be talking about more about the federal relief package from the Chamber's perspective, work they're doing on our behalf up there in Washington, D.C. And then on Tuesday, we're going to be visiting with Sean Bauman at Emmy and the great work that a locally owned, operated, and grown business is doing. Local business, how they are working to address a global pandemic. And they're just doing incredible work. And so we have some other events like that will be lined out. But today's event is especially for Chamber members, and so we're thrilled that you're here. Just again, a couple ground rules. I've got everybody should be muted, at least that's the plan. What I would ask is if you're not muted, mute yourself, and I'm going to engage the Congressman with some questions, just a few. And then if you would like to inquire with the Congressman on a topic, if you would just put those in the chat function on your computer, they'll go into the Zoom group chat, and I will share those with the Congressman. If he doesn't see those on his screen, we'll try to get through as many of those as possible in the next hour. And then if by chance, I've learned that if by chance things get, if the buffering gets a little too much, I would just ask that you might change your video option to either the static, your name, or the photo, okay? So if it starts buffering, you may keep that in mind, that you might change to your static name or the photo that you have. Okay, so thank you for everybody for following along with those rules. Again, Congressman, thank you for being here. And to begin with, would you mind just kind of giving us just a quick down and dirty on where we are right now? I know we're kind of in the middle of phase 3, but there's been some other phase 1 and phase 2 relief programs that were passed. And you want to kind of give us an update on
that
on a federal level.
I'd be happy to do that. This is probably the most extraordinarily complex set of pieces of legislation Congress has ever produced. Certainly the third bill itself is the largest single bill in terms of financial firepower ever passed by any legislative body in the world. So let me just go back to the beginning very quickly. Remember, this all begins barely 12 weeks ago. We're 13 weeks away from having first heard about coronavirus. The United States heard through the WHO and then through China literally New Year's Eve of 2019, and over the next few days, that there was a disease problem in China that probably wouldn't be contained within the borders, and it was going to pose some sort of threat, although I don't think anybody understood the magnitude of it. And certainly the Chinese were, I think, less than forthcoming. I mean, they knew quicker than anybody how big a problem they had, and I think tried to contain it. And that didn't help them, and it certainly hasn't helped anybody else. So hopefully they've learned a lesson, and we've all learned a lesson. After that, you have, by the end of the month, the president declaring a national health emergency, and then subsequently the next month, a national emergency, imposing travel restrictions and quarantine protocols, first for China, then later for Europe. Those are all, and the first funds deployed really beginning in early January out of the Infectious Disease Rapid Response Fund. Something, honestly, it was an idea of mine, just to be frank, that we set up about 2 or 3 years ago, so that when something like this happened, never envisioned something this large, but there would be money immediately available. You wouldn't wait around for Congress or special appropriations. You could get right on it. And that probably bought us some time, certainly got some Americans out of harm's way because it paid for the evacuation of Americans out of China under controlled conditions and then moved into quarantine conditions here. From a congressional standpoint, we began, getting legislative requests out of the administration in very late February, early March, and that led to 3 bills and 3 successive supplementals. The first one was pretty obvious. It was not a huge bill, but certainly a substantial amount of money, over $8 billion, mostly additional money for the National Institute of Health to accelerate, vaccine and diagnostics and therapeutics, also to the CDC, Center for Disease Control, which is kind of your frontline public health agency. Matter of fact, in our state, 60% of the budget for the state health department in Oklahoma comes from the Center for Disease Control. We're not even remotely self-sufficient, in funding our own state health effort, and nationally, they average about 50%. So, and then some additional money again for USAID to evacuate Americans caught overseas in difficult places when airline travel was being canceled, and quarantine measures and travel restrictions were going up, not just in our own country, but in quite a few others. The second bill was designed to help people that were beginning to lose their jobs. It was about $4 to $10 billion bill. Additional money for unemployment funds, a funding mechanism so that people, even if they had jobs where they didn't have sick leave, could get a couple of weeks worth of sick leave. The business would be compensated by the tax code, after the fact. It certainly created some hardships, but the aim was to try and keep people at home that otherwise would be at work because they needed a check and end up infecting a lot more people. There was also additional money for nutrition programs, Meals on Wheels for seniors, things like that, because in crisis you always get that. So again, that was aimed at the individual. Then the next one, the big one, the third one that we're dealing with now. And remember, this bill was passed, 2 weeks ago tomorrow. $2.3 trillion bill, multiple component parts. Roughly $100 billion for hospitals. And by the way, about 30 billion of that is going out today and tomorrow on a Medicare formula. So, we've been in communication with Norman Regional, for instance, and OU Health Science Centers. They're losing a ton of money by, voluntarily foregoing elective surgeries so they don't go through their protective personal equipment and, masks and that sort of stuff too fast. And so they're making an extraordinary sacrifice to stay prepared to deal with, an influx of patients. So we've got to find some way to obviously help manage that. So there was 100 billion set aside for that, 150 billion set aside for state, local, and tribal governments. We know they're going to suffer enormous loss of revenue. Sales tax, obviously, particularly in our state, is so critical to the funding of municipalities. So this will give at least some relief. There'll probably be, I would think, additional money later on, but this again was to establish fund. That money hasn't been distributed yet. They're still working out, but the aim is to get all that money out the door by the end of April. So you see huge chunks of money moving, on regulations written with extraordinary speed by Treasury, and usually regulations that are not nearly as complex or burdensome as they've been in the past. I've been on the phone with Treasury this morning on a couple of issues. They're the most customer-friendly government agency I've ever seen. They really are trying to move money and trying to solve problems. We have in there an additional, the most popular program, the one that we're most worried about running out of money, is this Paycheck Protection Program, which basically are loans to businesses of 500 and fewer employees. Those loans will be forgiven as long as at least 75% of them are used to maintain people on payroll. That's the whole idea, to try and help people keep their workforces intact. There's another $500 billion tranche that Treasury has available for larger businesses. Some of that's what taking care of the airlines and Boeing, for instance, right now. But we suspect that program will become considerably more ambitious and, again, focus on a lot of areas. You also see, by the way, massive intervention by the Fed in the economy, where they're buying incredible amounts of commercial paper and things to try and inject liquidity into the economy. There's more money in there for, again, unemployment compensation funds at the state level. Right now, if you declare unemployment or go file for unemployment, you've been let go. There's no waiting period, and there's an additional $600 through the end of June on top of your normal unemployment to try and keep people as whole as possible. In some places, that creates a perverse incentive, and there's efforts to try and fine tune that to where you'd have 100%. And frankly, if your business keeps you, you're not allowed to file for unemployment. In other words, if you just quit, you don't get it. You're supposed to be laid off before you're eligible for this. But again, there has been some concern that in some areas, again, the generosity is such that it might encourage people either to leave or certainly not to come back as quickly as they might be. So, enormously complex piece of legislation. Most of that, again, money is moving now. The discussions on a fourth package, and Secretary Mnuchin likes to talk about this as a baseball game, and he always says, think of the first three supplementals as the first three innings. There's going to be multiple pieces of legislation. You know, for instance, Scott, you mentioned up top, you have a U.S. Chamber discussion coming up. We were actually on the line, members of our caucus, about 70 or 80 of them, with U.S. Chamber, Business Roundtable, U.S. Manufacturers Association, and NFIB yesterday. And Suzanne Clark, he's actually an old friend of mine. They were my largest client when I was in private business. And so we've known one another a good 20 years. And she was laying out everything from liability protection, particularly for these businesses that have moved quickly from what they normally do in a national emergency to do other things. You know, I have an example down in Pauls Valley. Some of you may have seen of a company, Covercraft. Yes, Covercraft, I'm sorry, that normally makes automotive seat covers and things of that nature, switching over to masks, bringing workers back, enormously helpful. They're producing about 4,000 a day. Now, we have other instances of that happening, and you've all seen, I don't know how many distilleries we've lost that have turned into companies turning out hand sanitizers, but I haven't noticed too much of a drop in the alcohol supply, so I guess we're managing through. But point is, there's a whole range of things we need to do, and probably look at things too, like tax incentives for rehiring later on down the road. So there's a number of agendas that have been made from a Republican standpoint, not to be partisan, because I really want to underline, so far till today, most of this have been amazingly bipartisan. Remember, we're coming right out of impeachment, which is about as divisive as you can be, and yet the federal government has actually operated with almost no dissenting votes on all three of these pieces of legislation that I mentioned. That's incredible, particularly with the speed they were put together. Hopefully the danger here is always that somebody wants to use these for things things that, by the way, may be worthy. I mean, one of the stumbling things we ran to in the third supplemental, one of the things a lot of us from energy states wanted was, this is an extraordinarily good time to fill up the strategic oil reserve. I mean, you're never going to see prices at this level again, so it would help stabilize the price. It's a bargain for the country. Frankly, we occasionally pull oil out and sell it at higher prices to fund particular items. Those days will come. But our friends on the Democratic side weren't interested in doing that unless there were also tax credits for green energy and for wind. And again, those may or may not be worthy objectives, but they're certainly not appropriate in what's primarily a coronavirus thing. And you could make the same argument about the energy measure because it's not directly related to coronavirus either. So anyway, there's been some tough decisions, some partisan elbowing. You saw some of that today in the Senate. The Majority Leader Mitch McConnell moved to put an additional $250 billion in this PPP program. By the way, over 100 of that billion of the original 350 is already out the door. We were on the phone earlier today with the SBA administrator and her top people. And obviously a lot of our banks and even people that have not historically been involved in SBA lending are involved in this too. So we're really moving the money at extraordinary speed. The projections are they'll be out of money sometime around the 15th or 16th of April in that particular program. Now, my guess is we will fill it back up, but the Democrats can object to a unanimous consent. Any member can. In this case, Chuck Schumer did. He did because he wants other things involved, additional $100 billion for hospital, an additional $150 billion for state and local governments, an additional 15% for the SNAP accounts, nutrition accounts. Those, by the way, may all be worthy things. They're worth thinking about, but none of those programs are anywhere short of money. We haven't gotten the original tranche out as rapidly as we have this PPP program. I mean, that's partly because there's so many more institutions involved in making these loans to either their existing client base or to other people. So, the request was, let's do this now. We'll come back and do the others, but hopefully that'll get settled one way or the other in Washington, D.C. What we don't need is a lot of leveraging by the two sides. It's been a pretty exceptional effort of working together in a political year with obviously the presidency at stake and with control of the Senate and the House at balance. And we need to keep it there and keep moving on things where we have common agreement as rapidly as we can. So that's probably more than you wanted to know. And I'd rather move here, Scott, to questions that you might have. And so I focus down on the things that interest you and the other members of the chamber the most.
You bet. Let me follow up on one of the things you brought up was that $250 billion additional infusion into the PPP. I understand that if the Senate takes that up and adds that to that existing program, that you wouldn't need to go back up to DC to vote on that. Is that correct?
Well, as long as nobody in the chamber objects, there's a procedure called unanimous consent. And that means we can adopt it by a voice vote. There'll be a very few members there. The chamber is still open. The House is open next week and technically in session, but they're literally, you turn on C-SPAN, there's nobody there. And they'll go in, they'll call into session. And unless there's a legislative body, they'll gavel out right away, usually with only two members in the chamber, one in the chair and one that is making the motions from the floor. But if a single member, and if you'll remember on the final passage of the third supplemental, there was one guy from Kentucky, Thomas Massey, who tried to force a vote on it. Hundreds of members, because if you do that, there at least has to be a quorum present. So there had to be more than half of the 435 members there. And so lots of members went. I mean, frankly, I would have gone, but I was actually in quarantine because I'd been in contact with a member that tested positive and had a pretty severe case of COVID-19. I was very lucky. Nothing happened to me. Kendra Horn was in the same boat, and at literally almost the same, I think the same day with a different member, a Democratic member that she happened to be at a dinner with. So, but other than people like us that literally couldn't legally, we were told, it's called self-quarantine, but it's not. The house physician tells you you are quarantined, and believe me, your constituents then tell you you are quarantined. They don't want to see you anyplace. So it's effectively keeps you down. But a lot of members that, number one, put themselves at risk, or they were very worried they might be putting other people at risk because you can be asymptomatic, show no symptoms, and perhaps carrying the disease. And members traveling as much as they do, they probably have a higher likelihood than most people of doing that. I was talking to a friend of mine, Mike McCall, who's the top Republican on the Foreign Relations Committee, used to head Homeland Security. really one of the best members in Congress, in my view. And the guy has asthma. That's not, you don't want to be traveling with an underlying condition. And he got on an airplane, went back to Washington, D.C., because he just thought it was absolutely critical that bill, not a perfect bill, but an important bill, be passed. So again, one member can bring us all back. And, we're all wondering what Mr. Massey will do, and anybody else out there that chooses to. But, that's the risk you run. And if that happens, the votes are there to, sooner or later, we're going to get this $250 billion. This is really a little bit of, brinksmanship, which I think is not good in a crisis. But at the end of the day, they'll work out a difference. I don't think we're going to allow this program of all programs, which has been the most popular, run out of money. And so far, remember, when we passed this legislation, we passed a bill that spent more in a day than Congress normally appropriates in a year. This is, and that's usually in 12 different bills after multiple, committee hearings and amendments and all that. So for something to move this size, this fast, is pretty unprecedented. And I'm pretty amazed we only had one person, rolling hand grenades down the aisle, so to speak. And he got steamrolled, but you still had to have half the members there to get it done under the rules.
Well, I haven't seen too many of our banker friends on this call, because I know they have been.
I bet.
So the more we can help get the money into the small businesses is great. So I'm going to ask you some of these questions that we've had provided by those that are on the call today. First one's from Jim, who's with Visit Norman, our Convention and Visitors Bureau in town. He states that the PPP currently does not allow 501c6 organizations to apply for help. There are over 300 destination marketing organizations around the nation with thousands of employees. These organizations are funded with guest tax, and these funding streams have been decimated by COVID-19. Is there any traction to including 501c6 organizations in the next phase? And would you support an action? And I'll throw in there personally, chambers of commerce are also in that same 501c6 category. So we are very much supportive of being added.
Yeah, I would support it. Your pressure aside. But seriously, there is very serious discussion about this. Look, we knew when we did this that it was going to have to come back and be revisions, additions, and that sort of thing. And this is every member's got chambers of commerce. Every member represents organizations like these. And I think the instinct is to try and do it. Now, we get into some arguments. I've been in a heated argument this morning, and it's not an unfriendly argument, but discussion. Small Business Administration, for instance, doesn't, if you get more than 30% of your income from gaming, you're not eligible. Now, the big tribes in Oklahoma, operate facilities and workforces that they're not eligible for this program anyway. I mean, there are more than 500 employees. So we're not talking about, Cherokees, but there are a lot of smaller tribes that have one gaming facility, maybe 100, 150 employees. And the revenue coming out of there is about 80 or 90% of their tribal budget, which maybe, goes on top of Indian health funding for additional, a clinic or senior citizens center or nutrition programs of their own. So, and then we've got a lot of other states where maybe you're a truck stop and you've got a couple of gaming machines or something like, something unrelated to your main business, but it might provide more than 30% of your income. And those people are left out. So it's been a very interesting coalition. So, but back to the main point, number one, I would support it. Number two, it's being discussed. I don't know what its status is right now. A lot of these things, we're trying to encourage Treasury to be as aggressive and creative and flexible in these deals as we can. So if we can move something along by rulemaking, we prefer that because it tends to be faster and it doesn't get you into a legislative trading game back and forth where, well, I'll give you this, but I need to get that sort of deal or I'm going to object. So again, it's being looked at, and I think there'll be considerable bipartisan support for it. I'm just not, sure yet, when and how it will resolve itself in the end.
Okay, very good. Our next question is from Kyla McMoran. She works for a local nonprofit, and she states that there is new talk about essential workers getting hazard pay in a fourth package. Several nonprofit organizations are essential. I represent a local domestic violence shelter and rape crisis center. Know if these businesses would be included. Food banks, Meals on Wheels, CASA, homeless shelters would be others who are definitely providing essential services and potentially exposing themselves to the virus on a daily basis.
Yeah, no, again, considerable discussion about this. How it would work is really up to, up for discussion. Pretty easy if you're talking about direct state or local employees. We know who they are. We know how to get the entities to pay them the money. More difficult in the nonprofit world. There's also some talk about a 50% tax credit for workers that are doing that. And this is getting to be a serious thing. I was, again, on the line with, one of the critical things is to keep food moving and all this. So you got workers at food processing plants that wondering why, and in many cases, those are not particularly high paid jobs. Why are we going in, working, risking ourselves when nobody else is? So is this an area where we would need to look at? All I can tell you is these things are being sorted through. Right now, I would think the more likely first response would be a tax credit of some sort, a refundable tax credit for some percentage of it, so it wasn't all on the federal government, and that the employer had some skin in the game too. But again, that's just at this point very much at the discussion stage.
Okay. Our next question comes from Mike Fowler. Mike states, there is an article that I saw today that they now know why some people die from the virus. Men over 50 with diabetes, heart issues, and respiratory issues. Knowing this, will the government be putting less restrictions on the public or businesses? And can the government get the states and city government to follow more consistent, sensible guidelines?
Could you repeat the first part of that? You broke up a little bit.
Sure. There was an article that he saw today that they now know why some people die from the virus, such as men over 50 with diabetes, heart issues, and respiratory issues. Knowing this, will the government be putting less restrictions on the public and businesses? And can the federal government get the state and city government to follow more consistent, sensible guidelines?
Yeah, my guess is the first part of the question, yes, at some point. In other words, we're already starting to have discussions about how you reopen the economy, and do you put stay in place, so to speak, on particular categories of especially vulnerable people, whereas people that are less at risk, you free them up from restrictions. So that's going to be a delicate balancing act, but there is very serious discussion about how to do that, and then also how to do it geographically. There's obviously, it's certainly a serious situation in Oklahoma. But, just think of New York; it's twice our size. We think a really bad day is yesterday I think we lost 16 people. That is a bad day. They think a good day is when they lose less than 600. So, the scale of what's happening in New York City versus here, how quickly an Oklahoma or a North and South Dakota, places that are, frankly, historically a little bit more remote and removed, easier to bring them back online. They haven't been hit as hard in the first place. So those things are all underway. In terms of the state and local thing, this is a real problem for us. For instance, different governors will have different ideas about what an essential service is. And so particularly if you're a state operating or a company operating in multiple states, you may find you're an essential service in one state, but not in another state. How do you operate? The federal government can do a lot here to encourage, but we have a federal system for a reason. And a lot of the criticism, for instance, why isn't the president ordering everybody to shelter in place? Constitutionally, he really doesn't have that problem. Your governors and your mayors actually have more ability within the geographic units that they're over to restrict movement than any president of the United States has ever had. Now, he has considerable moral authority, and Center for Disease Control and National Institute of Health make the same point to us. They can strongly suggest things. In many cases, they can't order or mandate them. It's up at the end of the day, the state government. That's just one of both the advantages and sometimes disadvantages of a federal system. So I think they'll try and harmonize these things as much as they can, but it also allows a lot of flexibility. Again, a Governor Cuomo in New York is looking at a very different situation than a Governor Stitt in Oklahoma is, and may need to make different decisions accordingly. So, there's a lot of strength to this system, and probably some areas have escaped, particularly the more rural areas have probably been, have not been as heavily regulated as they would be if we were doing a one-size-fits-all to take care of New York City and Los Angeles, so to speak. That could make life a lot more difficult. So there's some downside to it for sure, but boy, the flexibility can be very, very helpful.
Sure. Okay. Our next question comes from John Woods with the University of Oklahoma. He states, thank you for your support of the CARES Act and assist in navigating the funds for OU and OU Health Science Center. Higher education has taken a hard revenue hit and needs consideration in any follow-up legislation. Appreciate your help in that. I also believe any follow-up needs to invest in economic stimulus, such as infrastructure, research, supply chain, lessening foreign influence. Can you speak to what we may see?
Yeah, well, first of all, John, thank everybody at the University of Oklahoma for the great job they're doing. I mean, the project you just talked about, which we're trying to get some federal assistance for under the third supplemental, University of Oklahoma was adding about 144 beds to the hospital up at the Health Science Center, 72 ICU units. Those were due to come online in October, early November timeframe. They talked with their contractors. There's an opportunity to speed that up and bring them online in July, which we may really need them in July for all we know. That cost about an extra $15 million. We're trying to make sure that the federal government, that the criteria we laid out in the bill make them eligible for a grant to try and help them do that. I think they're going to do it regardless, but I've actually talked to Dr. Redfield at the Center for Disease Control, excuse me, and to a gentleman named Bob Cadlick, who's the Assistant Secretary for Preparedness and Response at Health and Human Services. They're both actually really good friends of mine, and we again fund both those agencies in the committee in which I fit. They both think OU will almost certainly be eligible. So anyway, a lot of good work going there. I did talk, you mentioned additional assistance. There is over $30 billion in the CARES Act for education. Had a discussion this morning with Secretary DeVos, the Secretary of Education, and Rosa DeLaura. She's actually the Democratic chairman of the Health and Human Services thing. So we're trying to both speed that money out the door. There's a portion for colleges and universities. There's another portion for K through 12. We know a lot of schools are struggling to try and implement on the fly distance learning, things like that. So there is going to be a substantial tranche of money. But again, this is one of those things we gave very broad guidelines, lots of flexibility to the department to respond to things on the fly, and but with an imperative, the money needs to move. So I will tell you, there's a lot of conversations like we had this morning where literally the appropriators and other people involved in the legislative process are talking one-on-one with cabinet secretaries and their teams to try and make these things happen. So there's going to be some additional money for the higher ed system for sure, but also for K through 12. But exactly how it's going to be distributed, if they can, it's sort of like the hospitals, the first tranche of money out the door to them, which, as I said, is arriving or going out today and tomorrow, $30 billion. they knew if they just used Medicare payments that, that wouldn't be perfect. We have a couple of hundred children's hospitals, for instance, that are dealing with coronavirus. They don't get a lot of Medicare dollars. Obviously, their patients are not 65 and above. We're trying to we'll go back in a second tranche of money and find places like that. Same thing probably happened in education, but it's better to use an existing formula that people can sort of calculate. Okay, we know how much you got in Medicare receipts in 2019. We're going to give you X percentage of that. We know, you're foregoing elective surgeries. But even there, elective surgeries are important in every hospital, probably disproportionately important in rural hospitals. They're operating on thinner margins. Everybody's trying to build these kind of factors in on the fly and then respond to 535 members of Congress calling them up and saying, hey, you didn't get it exactly right in my district, or we're unique in this state. And those are legitimate concerns. That's true. All I can tell you is we're working through it as fast as we can and trying to get the money out the door.
One of the things John mentioned was infrastructure, and seeing our city manager on the call with us reminds me of a conversation he and I had earlier this week. I had heard that phase 4, they were talking about a significant amount of money for public infrastructure, potential roads. Is that the case? Can you
I
talk
think
about
that is, yeah, I think that's very likely, although not likely to be immediate. I mean, I see that as something probably coming together more in the summer than in the midst of the crisis right now. You almost want to get to the other side of the sort of stay in place rule that really runs effectively through the end of April and could be extended for all we know, could be extended in certain areas and not in others. That's being decided now by the administration. And again, there'll be significant input, but we don't know yet. I think the sense is that the infrastructure package, until you know what the economic effect of all this is going to be, is something you want to hold in reserve. But again, it's almost certainly going to happen. President certainly likes the idea, particularly if you're going to borrow money interest rate wise. It's hard to believe it's ever going to get any better than where you are right now. And at least at the end of the day, you're going to end up with something of lasting value. But right now, the focus is very much on trying to sustain particularly small businesses and major corporations to get them through this so they can continue to hire people on the other side of it and hopefully retain people, as many people as possible through it. And then we'll worry about the public works part later. But I think there'll be an awful lot of bipartisan support to do that, and a sense that there's a real need to do that to get the economy moving.
Okay, great. Our next question is from Kyle Allison with Andy Alligators. He asked, have you received an update on the EIDL loans from the SBA? We applied over 13 business days ago and have not heard anything. The PPP loans were funded pretty quick, but have not heard many EIDL loans getting funded.
Yeah, I think that's a fair point, and I think the SBA would be the first to agree with you. They're not always, I'm going to put this delicately because I think they're actually doing a really good job right now. They're not always the most nimble of federal agencies, but just to give you an idea of their program, the roughly $100 billion that they have already put out there since Friday, so less than a week, actually is 4 times more than what they annually do in all their loan portfolios. So it's a pretty Herculean effort on their part to move it. So I would just tell you, we're probably in a bottleneck. You can get us the information. We can, I actually had Patrick McHenry, who is the Republican head of financial services, and he and his staff bird dog these things. We may be able to get you an answer or at least check where it is in the status. So please call in. Will is right here, so I'll volunteer Will McPherson. But yeah, we will try and follow up on any specific questions you have like that. But I think probably the big problem is just simply they're handling more volume than they've ever handled And believe me, the requests are pretty extraordinary in terms of the sheer numbers. It's just going to take a little longer than you'd like. And we're having the same problem. For instance, we know some of our particularly smaller community banks aren't set up to process these things as rapidly. Originally, SBA wanted them all processed within 5 days. They've increased that to 10. We've got some people that aren't going to be able to make it in 10, but have a real need for the loan. They don't have the extra wherewithal. You're in a really small community in Allen, Oklahoma, with 1,000 people and one family bank. They just can't move through this as quickly as somebody else. So, again, I would not be surprised to see an extension on some of these things in terms of processing.
Well, folks on their call, are there any other questions you'd like to type in before we wrap up our conversation? If you'd like to interject a question, just feel free to type that in. Tom, are you going to, I assume that you are back in the district now for the foreseeable future?
Yeah, I'm back until we're called back. I'll certainly get back there if we have to go back, for instance, because somebody objects to unanimous consent. So I'm here. My guess, though, is we will be back in session in early to mid-May. We're in session now, but we'll be back with the members up there. You can't go too long in a situation like this because there's just going to be a lot of legislative issues. And under the rules of the House, you can't vote unless you're in the chamber. You can't hold official committee meetings on something like we're doing right now on a Zoom or anything. You literally have to be physically present. And a lot of legislation takes that. It takes the relationships, it takes the questions, it takes the persuasion. We actually have a hearing or a discussion next week in what's called the House Rules Committee, where I'm the top Republican. Every major bill goes through the Rules Committee to get to the floor. Every bill is assigned a rule, which tells you how many amendments, what those amendments are, how much time for debate, whether points of order are relevant, or things of that nature. So it's a pretty important committee, but it's also the committee that decides the procedures of the House. And so we're having a discussion next week because we have a lot of members, and it's surprising the splits inside both caucuses as to voting remotely. But I can tell you this: if you vote remotely, if you're in the minority, you lose a lot of your influence. And if you're not in leadership, if you're just an average member, you lose a lot of ability to affect the process. People just sort of automatically take your votes for granted. So it's one of those things that sounds great, but when you look at the practical implications, not to mention constitutional and parliamentary traditions and precedent, that's really hard to implement. So again, I would expect Congress will be back in session by early to mid-May.
And we've got another comment I'll share with the group. This is Randy Gardner with Cleveland County Habitat for Humanity. Just an FYI, I applied several weeks back for the EIDL loan. I was notified that my application was accepted and was under review, but never received notification that they were awaiting a number of documents. It wasn't until I logged into the site that I discovered mine was on hold, awaiting over 12 document uploads to include some I'd already provided. So just some of the logistical issues that folks may be running into.
Yeah, well, I have no doubt you're going to run into a host of them. I wish I could tell you with certainty, but again, the only thing I can plead is, number one, we'll certainly try and be helpful in any way that we can in focusing attention and helping you work through the problem. And certainly you should have been told if there was, some sort of, omission in the documents. But I will tell you, they are under extraordinary stress right now, and they're all working 24-hour days. And again, they're moving more loans out the door, so to speak, than, again, when you do four times, just think of your own business. And if you were doing 4 times as much as something in a week as you normally did in a year, what kind of stress would that put on your operation with the best effort possible? So that's really where they're at right now. Now, I would never tell them that face to face. Our business is to harass and harangue them and demand that they should be doing better. But I've actually been pretty impressed with the execution, particularly at Treasury. I mean, Mnuchin has sort of emerged as a real star in this, and his accessibility and the accessibility of his team has been pretty remarkable.
Well, Congressman, before I'm going to give you the kind of the closing comment here, but first off, I hope that you file for reelection, even though it's odd filing right now, right?
Well, I filed, but there's no shortage of other people interested in being the congressman from the 4th district. So I think I've got the first day I had a couple of Republicans, and I think there's a couple of Democrats. So we'll have a normal election season here, and that's fine. That's again, that's okay. That's how the system's supposed to work. In terms of closing, I'll just refer to a book that I picked up that you might give you some perspective right now. There's a pretty good book by a guy named John Barry called The Great Influenza, and it's on the influenza epidemic of 1918-19. And that's the closest thing to this. It's actually much worse. I mean, it killed 50 million to 100 million people worldwide over a 2-year period, 2/3 of those deaths in the first 24 weeks once it was identified, and 635,000 of them Americans. So we're grappling. We haven't seen anything like this in a long time. As I was telling Scott beforehand, Congress actually in the last 5 years has increased the funding for National Institute of Health by 39%, increased it for Center for Disease Control by 24%, increased the strategic stockpile funding by 34%, set up this infectious disease rapid response fund, all with the idea that we could see something like this because we had seen in the last few years SARS, MERS, both of those coming out of China, Ebola out of Africa, Zika out of South America. So a sense, that the biosphere is very active, and it always is. So the idea was to be ready. And yet with all that preparation, and there's a lot of finger pointing going on right now, I don't point my finger at anybody. This is a brand new virus that nobody had ever seen, like I said, till 12 or 13 weeks ago. And you'll see, diagnostics, we now have an abundance. That is, these tests, we're finally on the other side of that, both in terms of the numbers and we're, of different kinds of tests that can work, and increasingly the availability of testing. You're going to see diagnostics, and we've moved into clinical trials in terms of vaccines already on human beings. That's the fastest in recorded history. We've done that. So a lot of what's put in place is starting to work, but it's going to be slower than any of us would like, and it's going to present challenges. And I would just tell you, one of the things we're talking about is this could very easily come in waves. These things do, just as the great influenza did. They'll go down, and then there'll be a second wave. Usually won't be as severe as the first one. But I was actually talking to Dr. Redfield, and he made the point. He said, what worries me, Tom, in a place like Oklahoma, you may see it worse, the second wave, because it's not been as virulent there. And there'll be a certain amount of immunity in the New Yorks of the world, or the state of Washington was particularly hard hit, where a larger percentage of their population was infected. And again, we just don't know. We don't know how long your immunity lasts if you're affected. Is it something that lasts a matter of weeks, or is it something like the measles you get once and you're immune the rest of your life? We don't know. So we're going to learn an awful lot, but we're actually, doing some pretty extraordinary things. And thank goodness this country has invested. We have the scientific capability. Go back to 1918-19, there was no National Institute of Health. There was no government-sponsored research for vaccines. That was all done privately or for profit. There wasn't the base industry. There were very little medical research done in America. Actually, most of it was done in Germany, Europe. We were really way behind until the very late 19th, early 20th century, the rest of the world in this. It just wasn't seen as practical. But again, it gives you an idea of what we're grappling with. So if you have any spare time, if you're forced to be at home, go on and take a look at that book. It's you'll see a lot of historical parallels, and we'll give you some frame of reference for what we're grappling with, and how dangerous could be if, again, we're dealing with something that, as best we can tell, the lethality is between 1% and maybe 2 to 3. That sounds low, but by the same token, flu is 0.1%. So this thing is a minimum 10 times deadlier than the flu. So you got to take it pretty seriously, maybe as much as 20 times deadlier than. But if we had an Ebola outbreak in the United States, that kills 60 to 70% of the people that get infected. So this is this is something we'll handle, get through, but there's a lot of lessons to be learned as a country. And again, as I said earlier, we can't do this again. We can't do this to the economy again. So we're going to have a public health system so we can immediately get you diagnosed, tested, quarantine you, and build that network of who you've come in contact with. That's what they were trying to do early. Then we just got overwhelmed. At some certain point, it's in the population, so you can't follow this deal. But if we can follow that regimen going forward, you could keep businesses operating with very little risk to people. But it's going to take a much more robust public health system. I think we're probably got the research capability, but we're going to have to do an awful lot more in this area to avoid this. As I told the Republican leader, this is a time we're probably going to have to spend billions to save trillions, because we are going to not just spend trillions of dollars. And look, in 3 weeks for 17 million Americans to be unemployed is that's staggering. There's nothing like that. And the last 2 weeks statistics are literally multiples of 10 times higher than any previous period in American history in terms of number of people applying for unemployment. So, you got to make some investments to keep things like that from happening again.
Congressman Cole, I always appreciate your historical perspective, and also your optimism in the midst of a crisis like this is very well received.
Well, again, we got through the great influenza. It was a lot deadlier than this. And we had something called the Roaring Twenties after it, so it didn't leave the economy permanently damaged either. That was left to our own devices in the Great Depression. So we can, I will leave you this thought. It's actually been one of the most interesting things, having been up there during the Great Recession in 2008 and 9, which were very acrimonious politically in terms of passing things, getting things through. In this thing, there's nobody to blame. I mean, there were a lot of bad actors that led us into the crisis in 2008 and 9. Some of the big banks, principal amongst them, and Wall Street. Certainly not community banks, I want to hasten to add, but they ended up punished in Dodd-Frank. But here, this is nature. This isn't somebody. And if we want to complain about we weren't well enough prepared, I'd be the first to agree, except there's also something called the Johns Hopkins Global Health Security Index, which rates the ability of all 195 countries to deal with a pandemic. Guess who's rated as best prepared in the world? United States of America, who invests more in this stuff than anybody else. If even the best prepared country can end up this way, you're dealing with something that's well beyond what we would normally plan for and think of. So I actually think the country is doing a remarkably good job. And it's a great thing about Americans is they're an amazingly ingenious and adaptable people. And just as we were talking about Covercraft and them immediately adapting production, moving from something to some, important and nice, but something we really needed. That's happening in a lot of places around the country right now. And, we see a lot of this here. Incredible kindness by people checking on neighbors, making a call, churches reaching out to some of their older parishioners, people making a lot of individual sacrifices, but trying to think of other people along the way. So it makes you pretty proud of the kind of community Oklahoma is. And honestly, it makes you pretty proud of the kind of country the United States is.
Amen to that. That is a great place to end our conversation today. I want to say thank you to Congressman Cole and for each of you for joining us, making time in your busy schedule to be with us on this conversation. I encourage everybody to continue to Back on our website, normanchamber.com, we have a ton of great resources directly related to this pandemic there that you can avail yourself of. Also, look for us on social media. I'll remind you again that on Monday at 2, we'll be having a discussion with the U.S. Chamber of Commerce about some of the federal funding relief and expand on the conversation today about maybe what's forthcoming. So please tune into that. That'll be a Facebook Live event. Until then, I hope each of you stay well and be healthy. Take care.